21.2 Libby Ferguson. So aging is a degenerative process that affects your skeletal system, endocrine system, cardiovascular system, muscular system, respiratory system, and many other things. There are two types of aging. So you have biological aging. So this is the loss of cells, your organ inefficiency. You have slower repair of your organs, tissues, and muscles, and your immunity levels decrease. Then you have your chronological aging. So this is the unalterable number of years that you live. So that's just your age. So if you were 65, that would be your chronological age. However, there also is social aging. So this is when your roles change throughout your life. So it's how society expects you to be. So this is very much based around stereotypes, which we'll get onto in a second. And then there's also your psychological aging. So this is just your changes in learning. So memory will be affected, intelligence may decline, your personality are all psychological effects. So there is a growing population of people that are living to and over the age of 85. This increase in living expectancy is most likely due to the growing knowledge of medicine. So in 2017 there were statistics posted on the NHS spending by certain age ranges, and the highest spending age range was 85-year-olds and over, thus showing that their need for healthcare is important for them living so long. There are lots of stereotypes surrounding the elderly in sport, the biggest one probably being that when you get to a certain age and become an elder, then there are certain sports that you shouldn't be doing due to being fragile or weak, and that they should participate in sports that are non-contact and require minimal movement. So for example, elderly shouldn't be playing rugby or football, but should be participating in bowls. But what makes playing sports when you're older so much more risky than if you were to play at a younger age? Surely there are risks. Surely the risks are always going to be there. For example, in football, there's always going to be the risk of getting injured. So why does society frown or disapprove of older people participating in them? So moving on to the endocrine system. So in your body, everyone has a hormone called the human growth hormone. This is a hormone that is released by the pituitary gland into the bloodstream, and it helps to promote growth in children. However, once the growth plates in the bones have fused, then it no longer increases height, but it still helps to maintain the body structure as well as metabolism. However, there is such thing as a synthetic human growth hormone. However, this is banned within sports by the International Olympic Committee medical commissions in 1989, and this was due to it giving participants a greater muscle size and strength. So it would be more useful for sports that need power or explosive strength. As well, for athletes in recovery after a competition, it can also help the muscles to recover quicker, meaning that they can train for longer and harder. However, there are obviously side effects to taking this, as it causes organs such as your heart or your liver or kidneys to grow, which can lead to life-threatening problems. Now, this hormone decreases with age. So obviously, meaning sports that require power and explosive strength, such as weightlifting, aren't as easy for the elderly and are more risky for the elderly to participate in, as they don't have much of this hormone. Next is estrogen. So this is the female sex hormone, and can help with primarily, obviously, female development, but it also helps with bone health, aiding the health of the heart, increasing the level of serotonin in the body. So when females are coming up to the menopause, their estrogen levels will drop, and this can have effects on the body. So firstly, the bones will become weaker and more brittle, as the estrogen helps keep the bone strong, and without it, bone loss will occur. After the menopause has occurred, women have a higher risk of developing osteoporosis, as well as bone fractures. So this may therefore make it more difficult for females to participate in physical activities that, again, require this strength and power. However, Anice Shepherd, she's an 82-year-old bodybuilder, and she can bench press 115 stone. And this shows that even though there is a risk of fractures, etc., it isn't impossible to participate in exercise that does require this power and strength. So to help avoid getting brittle bones, taking on calcium is recommended as it helps to repair bone. As well as losing estrogen, when you lose estrogen, it will also increase the likelihood of females getting heart diseases, and this is due to the cholesterol levels increasing due to the decrease in this estrogen. So, to help with the level of estrogen, females are also able to go through hormone replacement therapy to get their levels back up. So lastly, there's testosterone. So this is the male sex hormone. This hormone gradually decreases again with male's age. It helps to build muscle and bone mass. When levels of testosterone drop, males will feel more fatigued and have a lower energy level. They will also have a loss in muscle mass. A decrease in muscle mass will result in an overall decrease in strength. This will lead to a decrease in performance of sports that require high levels of strength, such as weightlifting. Testosterone works to increase muscle mass by repairing the small tears in the muscles that are caused by exercises. In turn, this will lead to an increase in muscle gain. But obviously, without this testosterone, the muscle tears can't be fixed, which leaves them susceptible to injuries. There will be an increase in body fat, as there will become an imbalance between testosterone and estrogen within the body that there wasn't there before. If not controlled with exercise, then weight gain will occur, making sports that require high levels of speed or agility very tricky. And there will also be a decrease in bone mass, so therefore they're more likely to get fractures. Much like estrogen, hormone replacement therapy can be done to try and increase the level of testosterone. As well, exercise can be done to maintain muscle mass. So next we have the skeletal system. So as stated previously, with age comes bone loss or a decrease in muscle mass. So between the ages of 30 and 40, bone mass starts to reduce. The osteoblasts in the bone, so these are the cells that create the bone, begin to stop working. However, the osteoclasts, so these are the cells that reabsorb bone tissue, they carry on working. So this means that the bones are more easily broken and harder to repair. This process of losing bone mass is known as osteopenia. So the menopause can speed up this process. Therefore, females are more likely to have more fractures in their bones or breaks. This will affect sports that are violent and physical, such as rugby or boxing. As well as the risk of osteopenia, there is also the risk of arthritis. So this is when the cartilage inside a joint begins to break down. So this cartilage is there to help give the joint easier movement. So with this cartilage becoming thinner and breaking down, it will result in the bones rubbing. So this will cause friction, breaking down, which will then lead to the breakdown of the bone. This will make movement very painful and will affect any sport really that involves mobility, so such as football. But to help this, calcium can be taken to try and strengthen the bones. As well, in some cases, surgery can be done to replace the cartilage that's been broken down, which will then stop the painful mobility. Another risk is osteoarthritis. So this is when the joints stiffen due to the cartilage being thinner. So Ledley King is a footballer who whose cartilage started to thin due to his age. He used to swim as a training method, which increased his synovial fluid that was around his knee joint. So this would then lead to a decrease in friction in his joint. So the reason that this method works is because when you're in the water, it supports your weight, so it therefore takes the weight off of your joint. Swimming can also helps to reduce arthritis from getting worse, as it helps the participant to maintain their structure of the joint as well as muscular strength. So moving on to the cardiovascular system. So age affects the muscles around the heart, which will cause it to pump less blood around the body. This will result in fatigue as well as an increase in recovery time. This will therefore decrease the stroke volume as the myocardium are weaker, so the force generated from the heart will have decreased. This will therefore affect endurance events, such as a marathon. Age also affects the baroreceptors, so the function of them is to detect pressure changes in the arterial walls, and will therefore make adjustments to support this, such as vasoconstriction or dilation. However, with age, the sensitivity of them decreases, which therefore means they can't detect the necessary stimuli, which means they can't adjust. This therefore affects endurance athletes as the vessels aren't adapting to the environment, but also performances in extreme temperatures, so hot or cold. This will lead to a heightened blood pressure, hypertension, as well as injuries. So hypertension can in itself lead to serious conditions such as heart attacks or strokes, which will put the heart at risk of failure. As well as the baroreceptors not being able to detect high blood pressure, they also won't be able to detect low blood pressure. So therefore, the heart won't know to increase the amount of blood that's circulating. The walls of the capillary become thicker, which will make gas exchange less effective. So with thinner walls, oxygen and carbon dioxide are able to diffuse more easier. Therefore, with thicker walls, respiration occurs less effectively, making the person's aerobic capacity decrease. This will have an effect on long-distance athletes, as they aren't able to get the right amount of oxygen that's required. As well, thick walls in the capillaries means the lumen becomes smaller, so this will affect blood pressure. So due to the decreased efficiency of the baroreceptors, this won't be detected and therefore will lead to serious heart problems. So cardiovascular diseases become the major cause of deaths in males over 45 and females over 65. This may be down to the blockages that form in the blood vessels, also known as arteriosclerosis. This is when fatty materials build up on the linings of the vessels, causing the arteries to narrow, therefore reducing blood flow. Blood volume also decreases as you age. This will result in less oxygen being transported, as there is less red blood cells in the blood, therefore less hemoglobin to carry around the oxygen. This will therefore affect aerobic events, as there isn't enough oxygen in the blood or entering the body to satisfy the body's needs. So regular exercise can help to reduce this effect, as this will help strengthen the myocardium, resulting in more blood being able to be pumped around the body. As well, oxygen will help to reduce the build-up of the fatty materials in the arteries, therefore reducing the likelihood of cardiovascular related problems.